How does constipation cause a perianal fissure in children? Imagine trying to pass a very hard, large piece of stool that just won't move easily. When children are constipated, their bowel movements become difficult because the stool is dry and firm. This makes it hard to push out, and children often have to strain a lot to do so. Straining increases the pressure inside the anus, which is the opening through which stool leaves the body. This extra pressure can cause tiny tears or cracks in the lining of the anus, known as perianal fissures. These fissures happen because the hard, large stools stretch the delicate lining of the anus as they are forced out. When a child strains to pass these stools, the force can cause the thin tissue to tear. The tear is usually small but painful, and it might bleed a little. Because passing stool becomes painful, children may start to avoid having bowel movements altogether. This leads to even more constipation, making the stool even harder and larger, which then causes more tearing and pain. It becomes a cycle where constipation and fissures feed into each other. Sometimes children do not relax the muscles around their anus properly when trying to pass stool. This lack of relaxation can make the passage even more traumatic for the anal tissue. The pain from the fissure can make children afraid to have bowel movements, which worsens constipation and increases the risk of further tears. Most of these fissures heal well when constipation is treated. This includes giving children more high-fiber foods like fruits, vegetables, and whole grains, and encouraging them to drink plenty of fluids. Sometimes, doctors recommend stool softeners to make passing stool easier. Warm sitz baths can soothe the area and help reduce pain. Topical ointments may also be used to promote healing and relieving discomfort. If the fissures do not heal or become chronic, medical evaluation is necessary to explore other treatments. In summary, constipation causes perianal fissures in children because the hard, large stools stretch and tear the sensitive lining of the anus during painful bowel movements. This injury then causes pain and bleeding, which can make the child avoid bowel movements, worsening the constipation and the fissures. Proper management of constipation is essential to prevent and heal these tears, helping children feel more comfortable and healthy. Always consult a healthcare professional for personalized advice and treatment options.